We'll go ahead with Dr. Clayton giving today's update, and then we will take your questions.
Morning, everyone. Today we are reporting 49 new cases of COVID-19 in the state. This does include 5 new hospitalizations, 0 new deaths, 40 newly recovered individuals, as well as 707 new tests that have been performed. I did want to note that I've said new tests that were performed rather than persons testing negative. As you'll note on the website, we did have an overall decrease in the persons testing negative from yesterday's number of 98,531 down to 98,383. That is a result of a deduplication process that was occurred over the weekend, and so those numbers are corrected as of today. We have had a total of 8,444 COVID-19 cases identified in the state of South Dakota. Of those, 917 are considered active cases, and 7,404 are considered recovered. We have 47 individuals who are currently hospitalized and have a total of 123 deaths. The other update that I want to provide is we'll be transitioning to the total number of tests that have been performed since the start of COVID-19, and that is 132,613. I'll say that again, 132,613 total tests that have been performed. Now, those tests have been performed on 1,006. Having trouble with my decimal point or my thousands. 106,827 total unique persons. Now, from those 106,827 total unique persons, we have 8,444 positive individuals and 98,383 total persons who have tested negative. So again, we have now representing the number of total tests. The other information that I wanted to provide is that our community impact map updates, that we have no updates as of today. We do have several clusters I'd like to update you on. The first is Aventera St. Cloud. We have 39 individuals who have recovered out of 67 total cases among residents and staff. And that over the weekend, we did identify a number of cases were reported to us associated with Camp Judson, and that we had an inquiry over the weekend, and we're reporting less than 10 cases associated with that camp at this time. And Department of Health continues to investigate and continues to notify any of the campers that may have been exposed to those cases. The new cases by county include 1 in Beetle, 1 in Dual, 1 in Hanson, 1 in Kingsbury, 1 in Lake, 1 in Lawrence, 8 in Lincoln, 2 in Meade, 2 in Millette, 18 in Minnehaha, 2 in Oglala, Lakota, 8 in Pennington, and 3 in Union.
This is Secretary Kim Malsom-Rice, and I also wanted to share with folks on the call that we'd like your help in getting out some information around potential scam happening where individuals are calling people, telling them that they've been in contact with someone who has tested positive for COVID-19, and then asking them for credit card information so that a COVID-19 testing kit could be sent to them. That is obviously a scam that is trying to get money from people. And so if you in the media could help us get the word out that when the Department of Health calls you, if you've been identified as a close contact, we will never ask you for credit card information or for any money to be sent. So thank you for your help with that.
All right, I'm going to go ahead and unmute our lines, and then we will take your questions.
Ray from
We're ready for your question.
Hi,
Go ahead,
Ray
Ray.
from Kettleland. Yeah. See, one thing, when you look at the number of cases in Minnehaha and Lincoln County, is there any cause for concern there? They've been, hovering at 26 since July 15th off and on, except for 2 days, and then they jumped to 61, 49, and we're back up to 36 total for those two counties today. Any concerns there for those two counties?
So obviously, anytime we're seeing a large increase in cases, that is an area for concern. At this time, we have not identified any single exposure or exposures that would be the source of or cause of those illnesses and the jump in the cases within those communities. We continue to investigate those cases, and if there's anything that does require the public notice or larger awareness, that we'll be releasing that information as per our protocols.
Thank you.
Next question.
This is Lisa.
Stephen Gross from
I heard Lisa from the Argus Leader, I think, first.
The cases in Minnehaha and Lincoln County increased to 150 over the weekend. Is there any cause for concern for a surge or increase in cases more than we've seen?
Again, anytime we're seeing increases, as we have seen for Minnehaha and Lincoln counties, we do want to take a closer look at those cases and identify any sort of commonality. Whether we're seeing something that is related to a larger potential exposure event, we have not identified that through our investigations at this point. But one of the things that I want to make mention is, we do have the community impact map, and for that, Minnehaha continues to remain in that substantial transmission category. And so it's important that individuals do take precautions, and I think increases in cases like this, are the reason why we want folks to pay attention to, their individual actions to reduce the risk of COVID-19.
Next question.
Megan Morant, News Center 1.
Go ahead.
So two questions. First, how is contact tracing handled for out-of-state residents who test positive while in state or after being in the state?
So, Megan, this is Kim Malson-Rice, and so the process for COVID is similar to how other infectious diseases are investigated when we see residents of one state not in their state of residence when they test positive. So I just want to level set that what happens with COVID is the same process that we use across this country when we're seeing cases like measles or mumps or just other enteric diseases, those kinds of things. So what happens is when a person from out of South Dakota tests positive here, that case goes to their state of residence for investigation. That investigation is conducted by that other state, and if there are any residents of South Dakota who are identified through that investigation to be close contacts, then that state notifies the South Dakota Department of Health, and we get in touch with those close contacts. I would just tell you that this kind of reporting happens electronically, and so it's, again, because it's been in place for some time for other diseases, and so while it sounds like it might be kind of time-consuming, it happens actually very quickly and relatively efficiently.
Gotcha. So what has that looked like over the last couple of months as far as what states you've been in contact with, or about how often that has come into play here?
So again, that reporting happens automatically, so it's nothing that we actually even notify that state of. The lab result gets filtered through the system, and it goes to that person's state of residence.
And then the one thing I will add, and this is Dr. Clayton, because there are some times where we do not have the specific demographic information in terms of where a person lives. And so in those instances, those are handled manually, and that we do fax those reports to other states. And what I would say is, we have those occurring on a daily basis where we're providing notification because we do have areas of the state that act as hubs across borders.
Next
Gotcha.
question.
Thank you so much. And then the
Beth Gordon with Dakota News Now.
Go ahead, Beth.
Yes, we're hearing from people that have attended Camp Judson and their families that were tested positive, and they have not heard from the Department of Health yet. What is the turnaround time from when someone is notified that they have tested positive to getting contacted by your organization?
Yes. So what we do strive for is that we make that notification, or at least attempt that notification on the day that the test result is received, that is reported to the Department of Health. Now, we recognize that there can be delays in when an individual patient might be notified from the time that information on that positive test is relayed to the Department of Health, as well as for those individuals to be actually contacted. A call is made, but perhaps the individual does not pick up the line. And then we do strive to make those all of those notifications within that 24 to 48 hours.
So you can help us by reinforcing the message to pick up the phone if we're calling. That will really help us do that job.
Next question.
Kelly Volk with
Stephen
Kello
Groves
TV.
from VIP.
We'll go to Kelly Volk, and then we'll go to Stephen Groves.
Thank you. Could you say whether the fewer than 10 cases are campers or counselors and staff, or if not, could you give the age ranges of who is tested positive?
So we don't typically discuss in that length of detail clusters that we're investigating, but what I can say is that we have seen cases and primarily among campers from that facility, but I don't have a specific breakdown, and we don't often provide that or don't provide that as part of our investigations.
We'll go to Stephen Groves.
Hi. I noticed with the increase in reported cases over the weekend that there was also an increase in the number of tests reported. And I wondered if you could tell me if that was due to any specific mass testing event or policy changes with any labs or anything like that.
Stephen, this is Kim. I don't think we attribute the increase in results to any particular events. We do have, a series of testing events happening at any given time. We'll be rolling out some mass testing for EMS providers, West River here, starting this week as an example. But we do see just increasing test volume in general.
This is Dr. Clayton. I think one of the other areas that we have seen a revision in some of the CDC guidance around testing, and that specifically relates to not just testing of symptomatic individuals that have those symptoms compatible with COVID-19 illness, but that individuals who are asymptomatic close contacts that are at higher risk for COVID-19, that there's a recommendation from CDC to test those individuals, and so taking into account a prioritization scheme that or levels that they have developed. So I think a little bit of what we may be seeing is increasing potential for testing some of those individuals as well.
Next question.
Jack Cottle with KEVN and KOTA.
Go ahead, Jack.
When we did the daily briefings last week, the numbers, or the positive numbers for the 23rd and 24th were 66 and 57, but when you look at the positive chart today, it says for those 2 days it was 115 and 93. I'm trying to find out what is the difference between that number last week and today.
Yeah, and that is a very good question, and one that I want to make sure I clarify. So when we are reporting out the numbers for any given day, we make our cutoff at 1 p.m. the day previous. So the numbers that we are reporting out today are everything that we've received from 1 p.m. on Saturday through 1 p.m. on Sunday. And so when you look at the data on the website, that is reporting out the information for everything that happened within the 24-hour period from, midnight of Sunday morning to 11:59 p.m. on Sunday night. And so that's the difference in terms of when we make the cut, so that we can make sure we have our updated information on the website, which does split the day in half around the numbers that we have reported on the website versus what we report out as part of our media briefings.
Next question.
So are each of those over a 24-hour period then?
Yes. Each of those are over 24-hour periods. It's the difference in shifted of the 24-hour period. 1 p.m. to 1 p.m. for the media reporting, and then midnight to midnight for the for the charts on the website.
The trend
charts. And the trend charts on the website.
Next question.
This is Alex Portal with the Black Hills Pioneer.
Oh, the Black Hills Pioneer.
Thank you. You had mentioned that the out-of-state test results just get pulled directly from the electronic database and sent to the state of residence. Can you explain why that number isn't something that's collected by the state of South Dakota and reported, and is that something that we might get access to at some point in the future?
So what I can say is that, we do have a lot of those larger reporters that would be doing testing that that already have to submit because of the number of facilities that they have in other states, that they already have reporting requirements upon them for not only South Dakota but for other states, and that in those circumstances, their system automatically funnels that data, to the appropriate health department. For some of our smaller jurisdictions, smaller healthcare facilities and medical clinics and so on, that information does still come to the South Dakota Department of Health, and is then electronically transmitted to the county of residence or the state of residence for those out-of-state cases. So it is, both of those situations are happening with our reporting on a daily basis.
Next question.
JP at KON News Radio.
JP, go ahead.
Thank you very much. You made reference to beginning the mass testing of EMS West River, and I know you mentioned that'll eventually work its way east of the Missouri River. Do you have an estimate on how many EMS workers and eventually firefighters will be tested in this round?
Thank you, JP, for that question. So I would just make sure folks understand that this is a voluntary mass testing opportunity, but we could see upwards of 14,000 people tested with those particular groups by the time that we are done. And we'll be sure to report out results once we start to get those in.
All right, we have time for one more question.
This is Ray from Caroline. Ray from Caroline.
I heard Ray and Lisa, so we'll let you both ask a question. We'll go to Lisa first.
Thank you.
Okay. Are you still seeing delays of out-of-state commercial labs with the test results, and how many tests go to those out-of-state commercial labs?
So, Lisa, this is Kim. We don't have a count of how many go to those commercial labs until we get the actual test results in. So, don't have information for you on that. But we are still seeing delays of approximately 7 days for people to get those test results.
Ray, go ahead with your question.
Yeah, I want to go back to Camp Jordan. So you said less than 10 at this point in time. We have an overnight camp, roughly a week long. Is it conceivable that those numbers will increase, and is it conceivable that if there were 200 campers there, that we could potentially have 200 kids that need to isolate for 10 days? I mean, it's an overnight camp, and there's a lot of activity, a lot of close contact activity.
Yeah, that's a good question, and what I would say is there is specifically CDC guidance that does talk about how to safely run some of those summer camps and week-long camps and day camps and so on, and so the focus is to, as much as possible, distance individuals who are within those camps, and create little cohorts of campers that do not mix, while they're at the camp. And so, while yes, we do have 200 conceivably, 200 or so individuals that were at the camp, that, we do not anticipate that all of those individuals will be considered close contacts. Again, that definition of greater than 15 minutes within 6 feet, and that those individuals, because there will be the time that they're completing their quarantine will extend past when camp was released, that we could have individuals that do test positive at a later date that be part of this cluster of cases.
Okay, thanks.